So when a patient starts experiencing new symptoms, especially commonly headaches that are different from their usual headaches that are more persistent, have a different character or nature, um, it is often a good time to present to your primary care physician or a family physician. Other symptoms that should be concerning are new numbness or weakness, changes in speech, language, changes in memory. Some of these symptoms can be a sign of a new process or disease that's happening in the brain. If that were to happen, the family physician or the primary care physician will commonly order tests, and such tests include imaging, more commonly CAT scans of the head or MRIs of the brain, which can look for new diseases or processes that are happening. If there is a new disease or process, such as a tumor, in those situations, the primary care physician or family care physician will refer the patient to myself or a neurosurgeon for evaluation. Surgery for the brain has made significant strides and new innovations. Surgery for the brain does involve entering the brain, accessing the skull. Traditional methods are involving making a incision on the scalp, making a window in the bone to get access to the brain. Even with these traditional approaches, because of new techniques, patients often have a very limited time in the hospital. Average stay for patients with this type of surgery, called a craniotomy, is about 3 days in the hospital. However, what is more exciting and been developed has been new minimally invasive ways to treat processes in the brain. These minimally invasive approaches involve smaller openings in the skull and using new technologies such as endoscopes. Endoscopes are long, thin cameras that can be inserted through the skull to look into the brain. And in certain situations, for tumors in around the bottom, the base of the brain, around a portion of the brain called the pituitary gland, in fact, surgeries can be performed going through the nose. And these minimally invasive approaches, minimally invasive techniques, can allow a surgeon, such as myself, to remove tumors of the brain without making any incisions on the scalp or holes within the skull. The success of surgeries in this new era of neurosurgery in many cases is very high, and often we can have successful operations in 80 to 90% of cases. The goals of the surgery are often laid out specifically with the patients, but in many cases there can be a successful removal of a tumor, treatment of an aneurysm, or other condition of the brain. And the risks associated with surgery are more and more controlled, so that the risk of bleeding, the risk of infections, the risk from anesthesia, and risk of injury to the brain or stroke is very much reduced in the order of single-digit percentages, such as 2 to 4%. Protecting one's spine is something that's very important as people age. Proper ways to help maintain the health of your spine for both your neck and your low back include exercise, include good posture, and good diet, maintaining an optimal weight. However, there can be changes that occur in the spine as we age. These so-called degenerative changes occur and build over time, and they can lead to problems with the neck or the low back. These problems can lead to pain not just in the neck or low back, but importantly, many times pain in the arms or the legs. And this pain can be accompanied by numbness or weakness in the arms or legs. Often patients, especially who have severe changes in the low back, can have significant pain with walking, to the point that it limits their ability to move or walk as they normally would. If this occurs, it is important to see your primary care physician or your family physician, and appropriate tests and imaging can be performed. Such tests include CAT scans and, even more helpful in many cases, MRIs of the neck or low back. In spine surgery these days, there have been many new developments, and these new developments have allowed for what we call less invasive or minimally invasive techniques to treat conditions of the spine. Such techniques allow surgeons to use a smaller incision. These smaller incisions allow us to place small metal retractors or tubes that give us access to the spine. By doing this, it allows us to access areas of disease in the spine, allowing us to clear and remove that disease which is pushing on the nerves and causing symptoms. Often these incisions can be small, less than half an inch, and many times these type of surgeries allow patients to be able to leave the hospital the same day or the next day. In certain situations, the surgeon may, in addition to clearing the arthritis, may need to place additional screws or rods. These metal screws and rods allow for stabilization of the spine to prevent further changes or damage to the nerves. The success of spine surgery these days can often be as high as 80 to 90% in the appropriately selected patients. These high success rates are also associated with now lower risks of spine surgery, and the risks of bleeding, risks of infection are often well controlled to in the 2 to 4% range.